Well, hello everyone, and welcome to our first episode of 2025. I am so pleased to welcome, first of all, Jonathan, my co-host and partner in crime. Jonathan, Happy New Year! And are you ready to rock and roll after 46 episodes last year?
I don't believe we did that many. God, yeah, it was great. Great. We had some great people on. It was a great year, great first year.
Well, we have to top that. I mean, it was a kind of a tall order to figure out who is going to be our first episode for 2025. And so I think, maybe slightly biased opinion here, but I absolutely think we took the challenge head on, and I think we met the challenge head on. And so I'm super excited about our guest today. Our guest is a practicing clinician. He's a researcher. He's a fellow podcaster. He's an author. And most importantly, he is a fellow troublemaker for good. And so I couldn't be happier to introduce Dr. Kwadwo. And I am actually going to give you a little bit of a background on Dr. Kwadwo Kyeremanteng. Kwadwo, happy to have you. Welcome to the podcast. Let me just, at the risk of making you feel uncomfortable, read out a couple of your accolades and all the amazing things you've done in your career. You're currently the department head of clinical care at the Ottawa Hospital, where you not only take care of patients in the ED, but you also take care of patients in the ICU. That's the intensive care unit. You've spent a lot of your time in your research work on ways to improve ICU resources. You founded the Resource Optimization Network, which is a great multidisciplinary research group working on reducing health spending in this area without compromising quality care, which is something that we in this podcast and in our conversations are really excited to pick your brain on. And then on top of that, you are launching or have launched your first episode of a newly rebranded podcast, Prevention Over Prescription, very aptly named. So can't wait to talk to you about that. And I did mention that you are an entrepreneur. You founded during COVID Solving for Wellness, this virtual health and wellness platform for healthcare professionals that continues to help address healthcare burnout for practicing clinicians, which is huge issue and highly important now. And finally, we'll touch on your book. You have an Unapologetic Leadership. This is the book you already have there, but you have an upcoming book that we'll be asking you about as well. So with that, Kwadwo, welcome to Think Oral Health Podcast.
Listen, guys, number one, that intro was gangster. And second of all, it's a true privilege. I got to hear a couple episodes after meeting Maria at Health, and I had to have her on our show talking about all things oral health. So I am jacked. I'm ready to go. I'm excited. This is going to be amazing.
Oh, this is amazing. And maybe we'll start with our favorite question that drives both Jonathan and I is, Kwadwo, what is your personal why? You've had a meandering path of being an entrepreneur, an author, a researcher, a practicing clinician. We like people who take the non-traditional, unbeaten path to where they are. So tell us a little bit about your personal why and how you landed where you are today.
Yeah, that's a great question, Maria. Well, in terms of like the personal why, like I always thought as someone that was drawn to a practice that is very sporadic and unpredictable in the intensive care unit. Like there could be you don't know what's walking through the door. I just figured that was part of me. But actually, the more I thought about the why for me, it really came down to justice. I think that's like a real strong value for me. And taking care of people when they're the most vulnerable so that they get the best care possible. That's important to me. My research area was in resource utilization, because we were constantly like spending so much money in healthcare, but we weren't seeing the outcomes that patients and families deserve. And so to me, that was a huge area where we need to serve our public better. And when you would see that resources being wasted, that meant that people, it's a fixed pot, at least in Canada. A lot of people aren't getting the care that they need in underserviced areas. So to me, that was a real passion. And because of that, it's led me into a focus on prevention. And
Yeah.
I've seen a lot of people suffer when they land in hospital, in the intensive care unit or anywhere in hospital. And it took a while for me to get there. But to me, the 80-20 of all this is just don't land in hospital. What can we do to prevent you from getting sick in the first place? And so this is why you see a lot of our content is on like how you eat, how you move, how you reduce your stress, how you connect with others, but also innovative ways that people are doing to address some of these issues. And I must say, Jonathan, you don't know this about me, but I have 2 sisters that are dentists. So when I started to hear about some of these connections in terms of the oral health and long-term outcomes, I was embarrassed to say.
Starting to light up.
Exactly.
So tell us a little bit about those connections, or in your search to utilize ICU resources better and ED cost without compromising quality. What are the things that you are now doing differently as the head of the department in the ED and as the individual to help you optimize resources as a organizational leader, but also as an individual preventing burnout? Because I venture to guess you do not lead a stress-free life. Your stress levels are probably relatively high.
Yeah. So, I mean, there's 2 components to that. So from a reduction in resource use, one of our, the key components for that to me is how do we prevent people from landing in ICU in the first place? So we've done a lot of initiatives. For example, we have a virtual critical care program that we initiated about 1.5 years ago, where we see patients in the periphery that are sick enough to potentially come to our center, but because we address their needs early, they're less likely to come in and get and land in tertiary or quaternary ICU. Yep. So that's a big area of interest in what we've been trying to lead, being more involved in less acute beds so that you have that level of expertise. That's at, a technical corporate level, what I'm doing. But then there's a whole wellness side. I always tell clinicians, especially during the pandemic, this was a big epiphany for me when I saw some of our most stoic and most, for lack of a better word, really resourceful clinicians succumb to a burnout. And to me, that was like a canary in the coal mine when I saw some of our colleagues just suffering. And so it's a lot of the stuff that we talk about, like, trying to take care of ourselves before we take care of others. And so that's, again, about how we eat, how we move, how we reduce our stress and connecting with others. But then also at an institutional level, like, there's some responsibilities I also think that organizations can do. Get rid of the red tape, get rid of redundant work. Let clinicians and experts do the work that they're best at and not get caught up in activities that don't really leverage that. And this is where we do a lot of work in AI too, for that reason. Like, how does AI make your work more efficient? And so I think those are the ways at a high level anyway, Maria, how we're trying to.
I mean, if we pick up on that theme, and Jonathan, I know you're itching to jump in here too, because the theme around burnout and clinician performance is huge in dental clinics and on the medical side. And sometimes it comes down to, getting staffing for the dental clinics, like shortage in hygienists, shortage in building out the right team around you. So if we think about some of those lessons learned, for the universal theme, unfortunately, is our clinical teams are burnt out. Dental teams, medical side. And I wonder if there's, technology as an augmentation tool, not a replacement tool, but as an augmentation tool in that sense, and what role it plays. Jump in here.
Was that a question you asked? I'm just
I
wondering,
am opening the door for you
did you try to throw
to
me a softball because
I am no, it's the Venetian doors of AI. It
switch.
augmented teams are open.
All right, let's talk about burnout. Because burnout, my take is burnout could happen in every industry. You could be an analyst, you could be working in finance, you could be working for a lunatic private equity leader. You know, we've seen plenty of great TV shows.
Never happens. Private equity doesn't have any of those. I don't know what you're talking about.
You can be in healthcare. So one of the things, and I got a feeling we're aligning, Roger, on this, is that we have to physically and mentally take care of ourselves. And the four domains of anti-aging and longevity is what I have spent, kind of almost unaware of, but kind of trying to live, which is nutrition and sleep and fitness and stress management or mindfulness. And if you whatever industry you're in, we're going to get headwinds. Look what's happening in Los Angeles right now. How are people dealing with this? Oh God, it's just so sad, and we will have to do our part and try to help. And that's why, we all believe deeply in helping each other. But
Tell me a little bit about how you use AI in your practice to help with helping clinicians practice at the top of their license.
Is this
who are you asking?
Both of you, because
you go first, because you're the guest. The guest always goes. What was first?
I'm enjoying the conversation. I'm easy, but the way we're okay. So at a corporate level, we've just started to use the AI scribes, which I think we're a little bit late to the party, but basically the ambient scribes that listen in on a patient interaction and take notes and allow you to be more efficient that way. My personal dream would be to use it for our nurses, because a lot of the time their workload isn't in the physical workload, it's the paperwork and the charting. So if we could offload them, to me, that would be massive. So that's a dream of mine. The other areas that we're exploring, we started a company called Osler AI, and it's basically a virtual platform. You call a number and you can take OSCEs, or oral standardized, oral standardized clinical exam, I think.
Clinical exam.
Yeah. So you're able to not only practice clinical scenarios, but you also get feedback from the software. And why I think this is great is because we're quite short on clinicians globally, but in Canada especially. And so this is an opportunity, for example, foreign trained grads to get the opportunity to be trained up and coached up and saying, hey, this is instead of because normally you would have to practice in a clinical, in a live clinical scenario or in a formalized test. Whereas now you could do this from your home. You could do this anywhere globally. And so these are the little things that we're doing. And with the software, we'll be able to like tutor people on specific topics. So really just becoming more efficient in educating folks and getting them up
the
to
learning
speed,
curve,
so that they could just be part of the workforce.
Yeah. Great.
Tremendous. I look at AI as tremendous co-pilot, as they say, and as technology gets inculcated into our industries, it's going to be pervasive in everything we do. So it's very exciting. But let me switch gears a little bit and give me a moment here, Filipova, because I just need a moment, because I want to switch gears because I am really excited about
Give one more use case for your clinic, though, please. The AI use case. Give us one AI use case.
What, for me?
Yeah.
Oh God, we have it everywhere. It's like medicine, adoption, 17 years of medicine, dentistry is even slower, but no, what's happening is we have AI reading our x-rays. We now will have it reading our CAT scans. CBCTs are going to be a standard of care in dentistry. We have, oh my God, we have robotics, just like the Da Vinci robot in orthopedics. We now have it in implant placement in the mouth, and that's all AI driven. We have it in note taking for sure.
The billing
everywhere you can think about it, whether you're in, an AI reading x-rays and you want to do treatment planning now. Remember that conversation we had with the CEO of Overjet? They're doing
Yeah.
that in Pearl also. It's like, how will AI, the biggest thing is trying to get consistency in the diagnostics, right? So you have to get to a fact base. And unfortunately, it's all about, there's too much subjectivity, because if you ask 5 dentists and you put up a set of x-rays, you're going to get probably 3 to 4 treatment plans. So how do we stand up? So that's a big plus. So there's so many places where AI is very exciting.
Yeah.
Okay, Marie, is it okay? Can I go on
Yes,
now?
please.
Thank you.
Now we've covered both. I want to do the mirror side, the dental and the
All
medical.
right. Okay. I understand. We're symmetrical now.
Yeah.
No, this is my, my Canadian brother here. We got an American and Canadian clinician. But I'm really excited about that you've been a leader, in your role as you, kind of gone through your own career, your own journey, this book about unapologetic leadership. And I'd love to hear, as you handle your teams, what's your philosophy on leadership? What was that book all about? What did you learn along the way that you see really helps you build that high performance team and high performance culture?
Yeah, thanks for that, Jonathan. I think, first of all, I never perceived myself doing anything on the leadership side per se. Like in medicine, I was just survival mode. And it was really the pandemic, to be honest with you, that that propelled me into leadership and to write the book. So I in Canada here, I saw a lot of underserviced, marginalized, racialized communities not being treated the same or not getting enough resources to manage the pandemic. I saw our kids really suffer. We had some of the longest school closures in North America up here in Ontario. This was a very different time where I shouldn't say very different time. It was a different time where it was easy to get canceled. It was easy to have your job threatened, which unfortunately we had a lot of threats. But one of the points during this pandemic, my wife and I, who's a psychologist, we say, we're seeing a lot of things that are being misrepresented during the pandemic, where we like, do we risk our careers or do we stand up for what we think is right? And we decide to stand. So I was very vocal on the need to get healthy and the fact that I wasn't seeing people that were unhealthy as patients. Like to this day, I still hadn't seen one unhealthy person in the ICU related to COVID. So, and amongst the other things that we're talking about, the school closures, racialized communities. And so it was a very trying time, but it was that lack of value-based leadership that made me want to write a book about it. I'm like, we need to dial into our values and not let fear overwhelm our decision-making. Because when we let fear dictate the way we operate, we're never operating at an optimal level. And I see this in the ICU. If I do fear-based decision-making there, my patients will suffer. And so to me, it was a very important message to get out there, especially when I think about my boys. I got 3 sons, and it's important to me that they have a roadmap for how to lead when it comes to be their time. Because what we saw during, at least locally here, what we saw during that time was not value-based leadership. And just to put some context in it, like I was, I don't know I'm trying to think of the US version, but I was doing like national updates about every day. Well, actually every day, sometimes twice a day during the peak of the pandemic.
According to the CDC, probably that's the equivalent, or
yeah, like you would have been I would have been on the equivalent of your CNN probably. Like I was on
TV updates. Yeah. Okay.
Yeah.
Gotcha.
Yeah. So I was going on at the most it was twice a day, but at times it was most of the time it was daily, giving updates on what we were seeing on the ground. And with those opportunities, I felt strongly about highlighting some areas where we needed to do better. And it was scary. It was, I still get PTSD from it. Like where people threaten we had threats to our family. We had threats to your job. Because, when people are scared and you get that messaging that if you don't close down schools, we're all going to die, or whatever message that was coming across, and people would react. And so, but luckily we're out of that situation. And I'm just grateful for the opportunity to be a spokesperson during that time it's changed me dramatically. And it's the way I lead too. Like, not to drag this on too much, but
Yeah.
what I say to my teams, like, I'm not one for red tape and I'm not one for like rules for the sake of rules. So if you are treating your patient the best way possible, you think it's the best way possible, but it's against some arbitrary rule, I will always back you. That's what I tell my staff. I'll take the bullet as long as you're looking out for the best interest of the patient. That's our value right there.
That's value-based leadership. Values-based leadership.
Yeah.
Yeah.
So it's not always easy, but it's the way to go.
It's great.
It's what they say, the true character shows when times get tough, not when times are good. So what you're made of, what your leadership is really when times get tough.
Right. Just to be character. Exactly. And COVID was exactly that, especially in the emergency rooms everywhere around the globe, everywhere around the world. So when you take that learning and let's play it forward, we don't have COVID anymore. You're building businesses and you think about, how do I create these high performance teams? How do I gain alignment and play that forward? Let's say you had to do a V2 on unapologetic leadership. I love that name, by the way.
Thank you.
It reminds me of Unreasonable Hospitality that Matt Gudero has written about, which is just a great read.
That's a good book.
About how we need to treat our people and treat the people we're serving. But so going after that, taking that fundamental of what you've learned, play it forward for me a little bit, as you look into the future of the things that you're working on, and how would you define your leadership style? Go deeper with us on value-based leadership.
Yeah, no, it's there's always a few things that I would always want to do better. And the times I've failed is when I haven't communicated this as best as likely as I would like to. And so I think that if I were to put a lens on some of this, is like being more consistent and vocal at what's important to our organization, what's important to our entrepreneurial or to our business. And some of the other concept, Jonathan, that we talk about, there's 4 principles that we talk about. One, the main one's the values, the not fear. The other one is like action, move. Like in medicine, especially, there's an analysis paralysis. And a lot of people actually, when they see me talk or act, they're surprised I'm in medicine because of my approach. But I highly encourage that on my teams. I want you to fail, like in a constructive way. Because I think, this is totally got a left field, but I had this buddy named Brian who was one of the least attractive dudes I can remember. But in the primetime bar days, he would always go home with someone, almost always. And I'm like, everyone would always ask, like, how's Brian like wheeling? And I'm like, he swings the bat so often. Like, he's just like, he's hitting on everyone and he's relentless. He failed. Like, I would say his batting percentage was like less than 100, but because he's swinging the bat all these times, like, you're going to get home. And so to me, this is, if I've learned anything as an entrepreneur, that is one of probably the most important things is action and being willing to fail. Cause like, I think if you swing the bat enough times, you are going to be successful. And so this is one of the things that I really encourage on the team. And then the last thing that I really get excited about is how do you create an environment where you could think outside the box? Like, I mean, I think there's entrepreneurs we're all entrepreneurs, so you appreciate this, that there's always the triple win. Like, I always feel like there's a spot where we all can win. And if you have that mindset going in, you're going to amount to some beautiful things. But so many people are so closed-minded and they have that black and white thinking. And once you kind of get out of the black and white and think of the gray, it's wonderful. Yeah. There's a book, I'm going to screw up the book, Integrative Thinking with Roger Martin. To me, this guy is he's amazing. But the concept is basically say if we're putting on a film festival, some people would say either we're going to make it like Cannes or we're going to make it like the Toronto Film Festival. And then they're just trying to base it like it's going to be either or. And he's like saying, why don't we take the best of Cannes? Why don't we take the best of Toronto Film Fest and create our own magic? Yeah. And this is exactly what integrative thinking is. It's like create your own choices. And because you see it everywhere. And this is not really something you teach in schools. It's not even at a post-secondary level, you don't really have this appreciation of outside the box thinking. But is
the opposite.
Beautiful.
In dental school, in medical school, they teach you don't deviate from the practice. You've got a checklist. Don't deviate from the checklist. If the checklist is met, that's the decision tree. That's how it works.
Absolutely. So and the beautiful thing, why I think I'm so attracted to entrepreneurship is like, I think you could always think of something to battle your way out. Like, oh man, sales are down, or no one's tapping into that lead magnet, or book sales are down. Like there's always that creative switch that you could lean in on and crawl out of. Anyways. So long story short, right. Any group or anytime I can lead in front of folks and say like, let's think outside the box. Like, how do we do this? To me is one of my favorite topics and things to explore.
Yeah, I love that.
Yeah. So many threads to pull on here, Jonathan, right? So many of our favorite topics.
But just Maria, stay with everybody's an entrepreneur from a standpoint, people who are looking to do things differently, people who are not satisfied with the status quo, people who's a change agent or wants to
take the unpopular decision, right? Because that's what leadership is. You have to be okay not being popular for a while.
Yeah.
Absolutely.
And that's a very uncomfortable place to be in.
Yeah.
In
that's what
the principle of innovation, one of the few things that kill innovation very effectively is staying in your comfort zone.
Yeah.
100%.
The famous line, get comfortable with being uncomfortable.
That's right. Well, I mean, and it's very hard. So I have a lot of empathy for that because it's not for everybody, right? That's why there are people who are really great at optimizing, right? I'll make that process 2% better. And that's a whole different skill set and it's much needed.
Yeah. And you need that person on your team for sure.
Yeah. But this
is one of the things that I like. The other draw to entrepreneurship, like I'm a little late to the game, but to realize this is that entrepreneurs are the ones that create change. They're the change makers. This is why, like, if I look back at some of the bigger shifts that we've made, at least even in healthcare, like, especially nowadays, it's entrepreneur driven. And so this is why I think I'm drawn to it personally, because as a person that was really looking to remedy many of our ailments in our current healthcare system, I think a lot of it can come from entrepreneurship, where there's an environment where you're okay to think outside the box, where you're okay to innovate. And
let's talk about that for a little bit, because you're in a safe place here when you talk about entrepreneurship and change agents. And I'm curious for all of us, let's talk about those unpopular decisions that entrepreneurs and unapologetic leaders would have to make as clinicians, as business executives, frankly, even as patients, right? Changing our own lifestyle. What are those unpopular decisions that every one of us needs to be making to be able to bridge the gap between unsustainable cost of care, high quality outcomes? Jonathan and I have made a career out of figuring out how we could bridge the silos on the medical and the dental side. But those unpopular decisions, it seems to me, are very common, whether you're trying to bridge nutrition and clinical outcomes, mental health and clinical outcomes, oral health and clinical outcomes. These are kind of a holistic, integrated thinking type decisions that are different from current status quo. So let's assume the world was populated with entrepreneurs who were not afraid of change. So, Kwadwo, what would be your top 2 or 3 unpopular decisions you think we need to make at a system level, at a patient level, at a business level?
Yeah, this is a good question. I'm just gonna go with, I don't know if this is the right order, but I'm just going top of mind. So in Canada, I think I'm gonna get drop kicked for saying this, but I do think we're gonna have a, a certain amount of privatization in our healthcare system that has to come. Like, we're not meeting the needs of the public. If you're waiting for a hip replacement at this stage, it could be 18 months to 3 years.
Wow.
Like, it's not right. And so we're going to have to explore other ways of trying to meet demand. So that's an unpopular one. The other unpopular one, I think, is learning from, this is going to get me in trouble too. I think there's a lot to be learned from our naturopathic colleagues and it's not so much what they're prescribing or whatever, but what they do is, like many engineers in life, they look at root causes. Like, what's driving disease? And we don't we don't approach disease states in medicine with that question. We learn, hey, you got type 2 diabetes? I got some insulin for you. I got some metformin. I got my Ozempic. We're ready to go. Right? I got that. You're mentally ill. I got that antipsychotic, antidepressant. Instead of saying, what is truly driving this? And this is why it's such an exciting time in medicine right now, where, for example, in the mental health space, when you hear Chris Palmer throw out, like, yeah, I think this is a metabolic health disease, mental health. Like, you improve somebody's metabolic health and you fix their mental concerns. Like, that's a big dip. Like, curing people's psychosis on ketogenic diets. Like, that's a big shift. Like, I think looking at root causes and learning from some of our colleagues, clinicians that are approaching it right in terms of looking at root causes, I think we can learn from that. The other areas, just in terms of paradigm shift, I don't think it is that controversial, but I do think I would be putting a bigger lever on technology than we are now. Like, I think we're going there, but certainly I think precision and personalization of medicine is coming. And I think whether it's information from your wearable, whether it's from some blood work that maybe is non-traditional, genetic testing, I'm not sure, but I do think leveraging tech we'd be remiss not to really embrace it, because I think it's going to just allow for more precise care, because we're not very precise when it comes to prescribing and treatment in many areas.
There's so much art to it, more art than science in some cases.
Exactly.
But let's stay there a little bit, Maria. Let me jump in for a second. The question is, where do you start? How do we make change? How do we become these change agents? Where do we start?
Jonathan froze.
Did
Perfect.
I freeze?
Are you back? Okay, good.
You're back.
I was supposed to have a good connection. So I was asking the question, where do we start? And here's a good data point. In North America, US, less than half of every medical school, less than half, about 42% by the current numbers, teaches the required baseline for nutrition in medical school. Now, when I was in medical school, first 2 years, we were all combined MDs and DMD students at Boston University. There was no nutritional course. So today, look how many decades, and it hasn't really changed that much. I'll give you one better. In dentistry, this connection of the mouth and the rest of the body, oral systemic medicine, which is, kind of what we call the discipline. And there, by the way, there's 58 systemic inflammatory diseases directly connected to inflammation in the mouth. And you find the pathogenic bacteria in the amyloid plaque, in the carotid artery, cardiovascular disease, and pancreatic cancer. I mean, on and on and on and on and on. So thinking about this, it's like, well, if we want to get upstream a little bit and we want to go root cause, we really got to understand and really dive into these basics. So I think there's got to be a movement, and that's why we all got to get together on this, is a movement where educationally, the young people coming out who are becoming the doctors and the oral health physicians and the dentists that are working together, understanding connection, and have a more holistic approach to their education and get away from that silozation of education.
Yeah.
Yeah. So your unpopular decision would be education, right? We need a
Be
new
one of the
generation of
throttles.
clinicians.
One of them we have to hit to
Yeah.
get
Yeah.
change going.
You know,
Yeah.
I'm a bit biased. Like, I know there's a lot of opposition within some of these traditional means. Like, you talk to an average clinician about some of this, there's going to be a lot of opposite. Oh, nutrition, or what do you do? Just listen to the food guide. You're good. Like, this is not that important. So part of me is like, you slap it in their face by empowering patients and really making sure they know about this, and they asking more of clinicians. Because if you're not getting your answers, 4 out of 5 people coming to your clinic are saying, "Hey man, I heard there's ties to my oral health and this, or there's ties to the way I eat and this." At some point, you're going to be either irrelevant, or you're going to have to like pivot and start being part of the, like, educate
Yeah.
yourself and being part of the solution. I'm a bit more optimistic about the youth coming in. I do think they see the benefits of being more holistic, but I don't trust, hey, University X, can you start a holistic nutrition program? I think
I think it's part of it. But at the end of the day, you get what you measure and you get what you pay for. And we currently measure, 30, 60, 90-day readmission rates. We measure hospital-borne infections, right? And we pay for care gaps, right? We don't, that's kind of where the education is part and parcel. And frankly, it's education, to Jonathan's point, not only in the clinical settings. Our business leaders need to be educated on the impact of their bottom line on, frankly, poor benefits, right? Cost of care, right? The famous example where Howard Schultz said that Starbucks spends more money on healthcare costs for their employees and their dependents than on coffee beans, right? So it really doesn't matter what business you're in. If you're running your own business and you're an executive and you're not aware of what the healthcare cost for your employees is, that's bad business.
Yeah, 100%.
So education on the clinical and the medical and the business side, but also I believe that we need to find a way to pay for, measure, and incentivize that reversal to equilibrium. Because I go back to my personal patient experience, and all of us are first and foremost patients. Right? Healthcare is personal. We know somebody who's going through it. We're going through it. I remember when I was gearing up for a pretty major surgery, diagnosed with a giant, very rare, benign tumor, but fairly rare. Everybody on my medical team was concerned with removing the tumor, not with getting Maria back to health. And these are two very different outcomes. Because removing my tumor, it was very successful surgery, 6 hours at Mass General, preserved both my kidneys, success. But that outcome sent me home with 2 months worth of opioids to manage my pain, and no conversation around movement, nutrition, managing inflammation in other ways. If somebody had said, I was the patient who was asking, okay, well, how do I get off the opioids? Because that's not health for me. Right? Getting me back to health is living my lifestyle where I'm active and I'm healthy and I'm not reliant on medication.
Yeah. Look, it goes back to this integrative thinking. And it's really taking more of this, what we're talking about, a holistic approach. Look, the healthcare system's broken. 20% of the United States GDP, we talk about it all the time, is costing just on healthcare because we're a sickness model. We got to get more preventative. We got to get upstream. We know it. But it takes a village, and we got to hit it with everything we got to make change. And that's just the way it is. But look,
unapologetic leadership and unpopular decisions, right?
Exactly. And you're at the front lines there, and you have the ability to create change with your people, and that's where it's going to start. It's all of us doing what we can do to impact and help this next generation.
Yeah.
So it's been a great conversation.
Yeah,
Really
great
great
conversation.
Thank you
Kwadwo,
so
for
much.
our listeners who want to listen to your podcast, find your book, please tell them where they could find you, and we will make sure we put the links to your book and your podcast in our show notes as well.
Yeah, no, thanks for this, Jonathan and Maria. Like, you can go to drkwadwo.ca to find out more of what we do, whether it's the talks, podcasts, our supplement brand, GATA. There's links there. We're pretty active on social media, that whether it's LinkedIn or Facebook, Instagram, YouTube, TikTok, at Quadcast, KWADCAST. And yeah, we're on the show, we call it Changing the Boogie. We really want to be able to like put a different lens on how we're approaching things. So starts with conversations, but we want to be the change. You know what I'm saying?
Yep. Thank you for changing the boogie and for your unapologetic leadership. So with that, I think we absolutely kicked off the year in the right way with the right caliber of conversation. And thank you to everybody, and see you next time.